Hello everyone, my name is Yan Lei from the Reproductive Hospital affiliated to Shandong University. Today I will talk about the reproductive surgeries and my related clinical studies. I will talk about the treatment principles of infertility and laparoscopy and hysteroscopy in reproductive surgeries. So what is infertility? A couple is considered infertile after unsuccessfully attempting to achieve pregnancy for 1 year. Out of all conditions, male factors account for 40%. Female factors account for 40%. The factors for both partners account for 20%. So this means half and half. For females, tubal occlusions, endometriosis, uterine factors, and ovulation are mainly contribute to infertility. And for males, azoospermia, oligospermia, teratozospermia, and male sex dysfunctions are causes of male infertility. Reproductive surgery is an important treatment for infertility. The principles of reproductive surgeries include: grasp the surgical indication and select suitable patients. And then you should choose the most minimal invasive method to reduce tissue damage. Find anatomical reconstruction to avoid complications. And you should combine with other methods and keep the fertility concept in mind. Laparoscopy and hysteroscopy are the most common methods for reproductive surgeries. Laparoscopy identifies previously unsuspected pathologic conditions in 30 to 50% of women with unexplained infertility, such as endometriosis and tuberculosis. Also, laparoscopy can treat pelvic adhesion or endometrioma, or hydrocephalus, etc. Persistent bilateral proximal tubal blockage on HSG suggests true anatomical obstruction of fallopian tube. Alternatively, it could be due to the presence of a polyp, myoma, or adhesion, and chronic return products of conception obstructing the proximal tubal ostium. Laparoscopic surgery with chromal perturbation and concomitant hysteroscopic tubal annulations is the most common surgical treatment of proximal tubal obstruction. Surgery for tubal ectopic pregnancy is a cause of middle obstruction. Our study showed that women with a prior history of EP, that is ectopic pregnancy, had a higher recurrence risk of EP after IVF in comparison with women with no history of EP. Previous EP has no effect on the main IVF outcomes. D5 embryo transfer reduces the risk for EP in cycles that use IVF-ICSI compared with D3 embryo transfer. These figures show the procedure of neosalpingostomy and fibroplasty to treat hydrocephalus. The main procedure includes perform delicate salpingo-overlysis if necessary, perform incisions at confluence of ampullary adhesions and access ampullary endosalpinx. Proceed with lip flap eversion if endosalpinx is adequate. And finally, the flaps can be everted by placing 2 or 3 number 50 or 60 absorbable synthetic sutures. Now, let's talk about fibroids. Our study suggested that although non-cavity distorting fibroids did not affect IVF-ICSI outcomes, intramural fibroids greater than 2.85 cm in size significantly impaired the delivery rate of patients undergoing IVF-ICSI. Our results also suggest that type 3 fibroids exerted a negative impact on the rates of implantation, clinical pregnancy, and live births in patients undergoing IVF-ICSI, but did not significantly increase the clinical miscarriage rate. The deleterious impact of type 3 fibroids was remarkable in women with type 3 fibroids with a diameter larger than 2.0 cm. Hysteroscopy is often done in infertile women starting IVF to improve their chance of having a baby. Women with an abnormal transvaginal ultrasound, recurrent spontaneous abortion, and recurrent implantation failure should be offered routine hysteroscopy before IVF. Hysteroscopy can also be used to treat uterine polyp, intrauterine adhesion, submucosal uterine fibroids, uterine malformation, retained products of conception, and atypical endometrial hyperplasia, etc. So our study about uterine polyps. We did a study about newly diagnosed heterosonic endometrial mass, that is HEM. Newly diagnosed HEM, less than 18 mm in diameter, monitored by transvaginal ultrasound, did not impair the outcomes of ART following controlled overstimulation in the study. If other conditions are suitable, completion of ART cycles should be the appropriate approach in such cases. Infertile patients with endometriosis had a higher prevalence of endometrial polyps, and those polyps are often combined with simple hyperplasia. Then we did some study about IUA. Our study showed the optimum waiting period for fresh embryo transfer after hysteroscopic adenolysis was 90 to 180 days in the current study. And TCRA improved the reproductive outcomes of patients with IUA, but the risk of miscarriage was higher than that in the general population. To avoid miscarriage, careful monitoring is critical for pregnant patients with a history of TCRA who undergo embryo transfers during IVF treatment. Then we also did some study about CE, chronic endometritis. Chronic endometritis is typically asymptomatic or only presents with mild symptoms. Pregnancy outcomes has been shown to improve after antibiotic treatment. Previously, we created a new hysteroscopic scoring system for diagnosing CE. Our hysteroscopic scoring system has a high sensitivity and specificity for CE. So the key points of this class include: first, a laparoscopy and hysteroscopy are important procedures for reproductive surgeries. And second, clinical studies related to reproductive surgeries are urgently needed, and more RCTs should be carried out. Thank you.